Here's a short presentation on hematological and oncological signs. Okay, so angular stomatitis. So this is where you get a bit of sort of inflammation and redness and pain at the corners of the patient's mouth. It can be caused by oral candidiasis, bacterial infection, poorly fitting dentures. There's actually limited evidence of it as a clinical sign as such, and that's based on the findings of a book called Mechanisms of Clinical Signs. Atrophic glossitis, again, you would say that this is usually a sign of anemia. Okay, so it can be a sign of iron, B12, folate, thiamine, niacin, vitamin E, or H. pylori infection, in fact. Okay, bone pain, you may see bone pain in malignancy. This can be caused by either a primary tumour expanding and stretching the periosteum of the bone, causing pain, or the hematological malignancy within the bone, causing almost like a compartment syndrome, starting to put a lot of pressure on the underside of the bone, and a bit of stretching of the periosteum as well. Chipmunk faces. Okay, you may see this in beta thalassemia. One of the things that can cause is extramedullary hematopoiesis. So the reason it causes that is because you're not making normal hemoglobin, and therefore you have an increased rate of destruction of them, and the extramedullary hematopoiesis actually occurs it can occur in the facial bones, and it can occur quite a lot of other places as well. So a lot of these abnormal cells will get caught up in the liver and the spleen, and you get your hepatosplenomegaly. If you take a skull x-ray of a patient, you'll see the heron end appearance of the skull. So you'll get protocolon enlargement, beta thalassemia, production of abnormal hemoglobin, which leads to increased destruction, mechanism of parotid swelling, and extramedullary hematopoiesis. Okay, conjunctival pallor. You may see this in lots of places, but you'll sort of see it in anemia, but it's quite non-specific really, because what I consider to be pale and what you consider to be pale can be really quite different things. Okay, anterior conjunctival rim pallor, as illustrated in the letter C, has been shown to have substantially more specificity than conjunctival pallor. Jaundice. There are many causes of jaundice. They can be prehepatic, hepatic, or post-hepatic. So you can have prehepatic hemolytic anemia, causing increased destruction of the red blood cells, and therefore increased circulating bilirubin. It's a lot easier to spot in lighter skinned people. In the darker skinned population, pay more close attention to the sclera, because it can be quite difficult to spot. Okay, now we've given you a bit of a hide and seek. So what is that? It's a concave shape to the nail rather than the normal convex appearance. It is in fact choroilinachia. The mechanism of it is actually unknown. You will see it in iron deficiency anemia, and you may also see it in Raynaud syndrome. Now we have three little pictures. It's of it's an oral mucosa, but it's of petechiae, purpura, and ecchymosis. Petechiae are 1 to 2 millimeters, purpura 3 millimeters plus, and ecchymosis I think are bigger than about 5 millimeters. So they're just sort of like little areas of redness that you can see. Look a bit like bruising really. Can be caused by thrombocytopenia or vasculitis. Thrombocytopenia is a reduction or an abnormally low quantity of thrombocytes in the blood, and as we all know, thrombocytes are our platelets responsible for blood clotting, so it stands to reason that if there's not enough platelets hanging around to do the job, then you're going to get little hemorrhages under the skin and bruising. Ooh, gingival hyperplasia. Yeah, gingival or hypertrophy or hyperplasia. The gingiva can increase in size, and in this instance, it's almost completely obliterated the teeth. Can be several causes, one of which can be leukemia. The leukemic cells get caught in the gingiva and cause them to hypertrophy. They can also be drug induced due to phenytoin or cyclosporin, and can also be a sign of scurvy. So lesser true late sign is where a patient gets a sudden growth of lots and lots and lots of these look like little moles. Okay, it can be associated with an adenocarcinoma of the stomach, liver, pancreas, colorectal, breast, or lung cancer. It's caused by paraneoplastic secretion of epidermal growth factor. and you need to worry if you get a sudden appearance of them really quickly. Okay, next is leukoplakia. Okay, this is white plaque-like stuff on the inside of the mouth, and it can't be scraped away. About 50% of your patients who do have this will have some kind of oral malignancy somewhere. So if you do see it, investigate the patient for cancer. Lymphadenopathy in itself is just swollen lymph nodes. Here we've got some really quite profoundly swollen lymph nodes. So lymphadenopathy itself is just an enlarged lymph node. It's usually the sign of something going on. Okay, there is a little mnemonic, which is Miami. So if you do see lymphadenopathy, think either some kind of malignancy, some kind of infectious cause. It could be autoimmune, it could be miscellaneous, it could sort of be anything, or it could be iatrogenic, for example, drugs could be causing it. And a virtuous node, which isn't illustrated on this, is a enlarged lymph node in the left supraclavicular fossa, which is commonly a gastric malignancy that has metastasized to that spot. So next we have the Purdue orange effect on the skin. This can be caused by breast cancer or an abscess. The left-hand image shows what it may look like in breast cancer. What happens is the neoplastic infiltrate blocks the lymphatics of the skin around the particular area, and it causes the hair follicles, which are anchored deeper into the skin, to stay where they are, and as it swells around them, it sort of the hair follicle pulls the skin in a little bit, and it makes it look like orange peel. So that's where that is. So you can see that kind of effect in breast cancer, or even around just an area of an abscess where the inflammation blocks the lymphatics, and you get the same kind of effect. The image on the right, again, we've got the Purdue orange appearance. This looks like it's a cause because of a rather tense ascites, which could be possibly causing it, or even a really tense ascites with an infectious component to it as well. Okay, right, so we'll talk about the prostate first. So an abnormal prostate on the PR examination will be a hard and irregular prostate. If it feels boggy, like if you're touching your cheek with your index finger, that can mean it might be infective, and your patient might have prostatitis there. Or if it's harder than the end of your nose, so the normal feeling is the end of your nose, an infective one is your cheek, and if it's harder than the end of your nose, then that could be a cancerous etiology. So the prostate itself should feel nice and smooth, with a nice smooth central sulcus. It is possible to get benign prostatic hyperplasia, where the prostate gets bigger and you get a bit of a loss of the central sulcus upon examination. But nonetheless, it should be smooth. In a cancerous, you would have an asymmetrical prostate with an irregular feel to it, with one's index finger. The majority of prostate cancers themselves are formed in the periphery of the gland, and the examiner actually feels for the cancer with the end of your index finger, so it's the periphery of your finger that you feel for it as well. So after that, we move on to Trousseau's sign of malignancy, not to be confused with Trousseau's sign of latent tetany. Trousseau's sign of latent tetany is a sign observed in patients with low calcium, whereas Trousseau's sign of malignancy is any unexplained thrombotic event that precedes identification of an occult visceral malignancy. One of the things that actually happens in cancer is that you do end up, by definition, being in a hypercoagulable state. So disseminated cancers or certain types of malignancy, such as pancreatic carcinoma, are sometimes associated with repeated attacks of multiple venous thrombosis at different and changing sites due to the procoagulant factors formed by the cancer cells. This is referred to as migratory thrombophlebitis or Trousseau syndrome.